Rear Admiral Sarah Linde, Chief Public Health Officer at the Health Resources and Services Administration of the U.S. Department of Health and Human Services. Thank you.
Thank you, Laura, and thank you for having me. It's an absolute pleasure to be here. If I could go on to the next slide. The mission of HRSA is to improve health and achieve health equity through access to quality services, a skilled health workforce, and innovative programs. So we work to improve access to health care services for millions of people who are uninsured, isolated, or medically vulnerable. The Healthy Weight Collaborative is one such innovative program. But first, I want to tell you a word or two more on HRSA. Next slide, please. How does HRSA achieve its mission? We have a budget of more than $9 billion, which funds 80 different grant programs. We support the Health Center program, which includes community health, migrant health, homeless health, and public housing centers. And that includes nearly 9,000 sites and serves 21 million patients. We also fund maternal and child health programs through partnerships with state and local governments, and 34 million women and children throughout the country benefit from those programs. The largest program is the Maternal and Child Health Services Block Grant to states, and this program focuses on reducing infant mortality and childhood illness and controlling costs associated with poor pre- and neonatal care. Our Ryan White HIV/AIDS program provides care and services for 500,000 people living with HIV and AIDS, and the National Health Service Corps and its over 9,000 primary health care professionals work in medically underserved communities in exchange for loan repayment or scholarships. Next slide, please. We also give financial support to colleges and universities, and in so doing develop and distribute and retain a diverse, culturally competent health workforce in the areas of medicine, dentistry, nursing, and public health. We're the lead federal agency that bolsters rural hospitals and coordinates coalitions of rural health providers to make healthcare more accessible for the 60 million residents of rural America. We oversee all organ, tissue, and blood cell donations. We're the federal agency primarily responsible for poison control, and we administer a drug discount program known as the 340B program that allows the neediest patients to receive discounted drugs through eligible providers participating in the program. Next slide, please. So now that you have a general overview of what HRSA does, I'd like next to talk about using quality improvement to prevent and treat obesity in communities, and specifically about HRSA's Healthy Weight Collaborative. HRSA has a long history of supporting evidence-based quality improvement activities for clinical care. For example, in the areas of HIV and AIDS care, organ transplantation, and maternal and child health. In September of 2010, $5 million was awarded to the National Initiative for Children's Healthcare Quality through a cooperative agreement and funded by the Prevention and Public Health Fund described in the Affordable Care Act to establish the Prevention Center for Healthy Weight, or also known as the Collaborate for Healthy Weight Initiative. There are two main activities of this initiative. One, to plan, manage, and implement the Healthy Weight Collaborative, and second, to serve as a resource center for widespread dissemination and communication of evidence-based interventions that focus on the link between primary care, public health, and community-related and the community related to obesity prevention and treatment. So this slide just shows you the timeline of other significant dates to include authorization of the Affordable Care Act in March of 2010. Next slide, please. So what exactly is the Healthy Weight Collaborative? It's a national quality improvement initiative using the Breakthrough Series approach in which multi-sector teams comprised of primary care, public health, and community, as well as consumer representatives, are applying evidence-based interventions to prevent and treat obesity in children and families. The Breakthrough Series was developed by the Institute for Healthcare Improvement in 1995 to help healthcare institutions design and execute rapid cycle quality improvement initiatives using evidence-based interventions that were capable of achieving widespread change in a relatively short time frame and closing the gap between what we know and what we do. Next slide, please. This is the scariest slide of the set, but this just shows you what the process of improvement is. The Healthy Weight teams engage stakeholders representing primary care, public health, and community, and this collaborative effort emphasizes common goals, rapid cycle change methodology, and integration, and it serves as the voice of the community. We believe that all three sectors have to collaborate using evidence-based approaches to reverse the obesity epidemic and improve the health of our communities. Using the Breakthrough Series, a collaborative is a short-term learning system that brings together a large number of teams, usually from clinical areas, to seek improvement in a focused topic area. For the Healthy Weight Collaborative, as I mentioned, the teams are not only clinical but also include primary care and the community, and the focused topic is a public health issue, obesity. So this slide shows the process of the Learning Collaborative, which includes team formation, faculty recruitment, a series of learning sessions interspersed with action periods during which action is planned, carried out, assessed, and revised. Next slide, please. For this collaborative, the aims were to establish sustainable partnerships and implement and test interventions to achieve healthy weight. In order to meet those aims, the collaborative supported approximately 50 teams from all over the country. In Phase 1, 10 teams with previous experience in cross-sector collaboration participated in both in-person and virtual learning sessions. And then in Phase 2, we added about 40 additional teams in an entirely virtual collaborative. The two-phased approach was intentional so that we could harvest the emerging lessons and refined experience of the Phase 1 work to inform and assist Phase 2 work. Next slide, please. So what interventions were tested? What have the teams learned? Have any of their changes been successful? How are the teams evaluating their work? And how do they plan to sustain those changes? Those are all great questions, and I'm excited to introduce you to two of our Healthy Weight Collaborative teams. The San Diego Healthy Weight Collaborative is being represented by Dr. Shayla Serpas, and the Florida Healthy Weight Collaborative is being represented by Kari Ellingstad. These are two of the standout teams who will describe in more detail the opportunities and challenges the Healthy Weight Collaborative presented, and also how they're evaluating their work.